Months on, boy, you stood up at the right moment. I love this. So with the help of my friend Daisy here again, we'd like to discuss a topic I call the home health exam. Now please be advised, we're not trying to make veterinarians out of pet owners, but, and this is a big but, we'd like you to be aware of how to keep your pet healthy at home by getting into the habit from their formative puppy months on by observing their body in general. What I mean by that is this. When you start with a young kitten or a young puppy, stem to stern awareness of what their body is like. There's a tremendous symmetry in animals. What's happening on the left side of the body happens on the right typically. If there's suddenly a swelling on one side of the body that doesn't match the other, you know that's a change. That change may or may not require a visit to the veterinarian. We want to start with the front end. Is their nose moist and somewhat cool like Daisy's is? Are the eyes clear and free of mucus or inflammation in the white of the eye? Are the ears developing an odor or a sensitivity to being touched? And Daisy is perfectly letting me do this very carefully and gently. Are there any perceptions of pain in the head and neck when you go down the body? When I'm doing an exam, my hands are like a radar going over the body symmetry to make sure that there isn't something that either has appeared and different from my previous notes or what the owner tells me is different. So I'm going to explore every part of their body, make sure joints are not swollen, muscle mass is adequate, that there's no pain anywhere, and this can be done gently. We don't want you to produce pain. We don't want to put anybody at risk by producing pain. But if you get into the habit of sensing via your sense of smell, your hands, touch, you'll be mimicking what we do in the veterinary office in a gentle way. On the bottom line, we like to make sure there's no obvious pain in the abdomen, there's no growths in the skin. It's almost like a home massage in a way. It's a way of staying in contact. But the power of taking time to do that on a regular basis from when they're small until they're adults is powerful. It's powerful because it brings them into an awareness as well that we're trying to help them. It also is very self-serving for me to say this because when this pet comes to the animal hospital and I'm doing the same explorations, perhaps with a little more depth, they're trusting because hands have never hurt them. Everything you do with them should be positive. Everything you should do with them is because they're wonderful children and they're our friends. So what's all this about vaccinations, folks? There's a lot of controversy about vaccines. What are they? They're agents that we inject into the body or distribute into the nasal passages or orally to try to prevent disease. But we do see a lot of diseases that are preventable. Some of these diseases, particularly in the area that we live in Suffolk County, New York, can be lethal. The first and top on the list internationally is rabies, of course. Rabies for any mammal is totally lethal. You cannot survive it. There's extremely rare instances of animals and people surviving rabies. It's the exception to the rule. So rabies is a core vaccine that must be observed. Typically in Daisy's life, she got one when she was at 16 weeks of age, and then we repeated it a year later. There's another virus that's ancient and used to be called hard pad disease, known as distemper virus. People have thought that this has something to do with their temperament. It's a very poor name in that it can affect the brain, but it affects many other systems too, the lungs, the intestinal tract. When I was younger, first out of school, I saw a lot of distemper virus in dogs. There's so many animals that are vaccinated against it today that we hardly ever see it anymore in this part of the country. It's considered a core vaccine. Many people have heard about parvovirus. Parvovirus is an intestinal virus of dogs, highly contagious. There are variants of parvovirus that sometimes can mutate and become difficult to vaccinate against, but currently we have parvovirus under control via vaccines. And it's typical in puppyhood, at least 2 to 3 vaccines are given, 3 weeks apart. They're very immunizing and very safe and far majority of the instances when it's given. One illness near and dear to my heart because it creates such havoc is kennel cough. There are variants of kennel cough, which is a combination of viral and bacterial agents that can be tremendously impairing for lung function. It can cause pneumonias in rare instances and even rarer cause death. It can last anywhere from 3 to 4 weeks. There's a wonderful new nasal vaccine out so that they don't have to get a needle. There's also an oral vaccine out so they can just take drops. And there is a traditional way of immunizing with an injection. Very annoying vaccine and highly recommended. Anywhere dogs congregate. Veterinary waiting rooms. boarding kennels, grooming shops. We never know what's coming through the door, right, Days? We don't want your dog to get sick, folks. And I have total respect for anybody's views on vaccines, whether you do or you don't. It's my job to impart the risk. It's so important to keep them healthy, so important to observe that pillar of foundation correctly. Thanks, folks. Hi, folks. Thank you for sharing this time with us today. If you like what you've heard, you like the content, please visit our website, like, share, and subscribe. And please leave comments. Help us build this content. Help us build this community. Thanks, folks.